Hi, everybody. My name's Margo Steinlage, and I am president of Steinlage Insurance Agency. Today, we are going to take a deep look into everything you need to know about Medicare. So, whether you are approaching your Medicare eligibility at age 65, or maybe you are hitting your 24th month of disability, you're under age 65, or maybe you delayed Medicare at age 65 and now you're ready to retire and come off that group plan. This webinar is geared towards anyone who is new to Medicare and needing to move into Medicare, or just wanting to get a better understanding of the rules and nuances as you approach your Medicare golden age of 65. So hopefully you will walk away with a better understanding of everything that Steinlage Insurance Agency and our team can assist with, and everything you need to know about Medicare. So let's jump in a little bit about myself and our agency here at Steinlage Insurance. We offer free guidance for everything that falls under Medicare. So whether you are needing a drug review or you need our assistance to determine the best supplement, our team can assist, and we never charge a fee for our services. Sometimes we get asked, how can that be? How can we offer such a great free service to those who are approaching their Medicare eligibility? Well, our brokerage goes and gets assigned with all of the firms and insurance carriers that offer a Medicare product. So not only are we helping you decide if Medicare is the right decision from the month you're turning 65, but also we are helping you if and when Medicare becomes the most appropriate pathway, we are helping you line up the most appropriate coverage your initial year into Medicare and also each year after. We are very proactive with our outreach, our annual reviews. We have an entire team of customer service representatives that help you get new cards. If there's an appeal or troubleshooting, you may need assistance with your pharmacy or your provider. Maybe there's a disconnect with the billing. Our team is here to offer a white glove service pre-enrollment for Medicare, post-enrollment, and any other time that a issue surfaces. So we take great pride in this because there's very few agencies and agents who go above and beyond, and that is our motto here at Steinlage Insurance, is to go above and beyond, go the extra mile, and keep you happy. Another area that we will discuss in depth today is if you are a high earning individual, you may see an income surcharge on your Medicare premiums. We're going to take a deep look into what does that income surcharge look like and how can we appeal the IRMA, the income surcharge, if at all possible. So again, this webinar is going to cover three kind of moving parts. Who is eligible for Medicare is the first segment of the presentation. What is Medicare? How do we determine what supplement is appropriate for you? What is a Medicare supplement versus Medigap plan? What's a Part D standalone drug plan, Medicare Advantage? And then we're also going to look in the third segment, what are some upcoming changes with the Inflation Reduction Act? How does IRMA play into this in Medicare premium and Medicare enrollment? So grab your coffee, grab your snack. It's going to be about a 45-minute presentation. And if you have any follow-up questions, I welcome you to reach out to us. You can email me, you can email your broker directly. We are always here to answer those questions as they surface. Also, let me go back one slide. We are licensed in all 50 states, and yes, we do have clients in all 50 states. Over the last decade, we have grown, and to accommodate our growth and our client needs, we've picked up licensing in all 50 states. So whether you're living in Missouri or Virginia or California or Florida, and you pick up and move, our team and our services follow you wherever your next adventure lies. Okay, so let's jump in with just the general rules around Medicare and enrollment on Medicare. So typically here, I like to tell clients and anyone that I'm educating that the general rule is that you need to sign up for Medicare at age 65 to avoid any lifelong penalties. So again, the general rule here is that as you approach your 65th birthday, there's this beautiful 3-month window right before your birth month of turning 65 that allows you to simply enroll in Medicare, Part A and Part B. And the general rule is that you need to enroll in this first 3-month window. My birthday's in June. So my enrollment eligibility would be March. All of March, April, and May, I can enroll for a June 1st effective date. Okay. The exception to this general rule that you need to sign up for Medicare at 65, the exception to that general rule is if you are working with a large employer, then Medicare becomes optional. Okay. So again, I'm kind of hitting the most um, general rules here because that applies to most of us. There may be some unique situations here, but again, you need to sign up for Medicare at 65 to avoid a lifelong penalty unless you or your spouse plan to continue working past age 65 and you're working with a large employer that is offering you or your spouse group health insurance. So you can piggyback on your spouse's work status and employer group coverage. The determining factor here, if you can delay Medicare at 65, is the size of the employer. So what Medicare is looking at is if you plan to work past age 65, you or your spouse, and that employer is a large employer, meaning it has 20 or more employees. It does not matter if these employees are part-time or full-time. It can be a combination of either or. What Medicare needs to see is that there's 20 or more employees. And if this is the case, then you are working with a large employer and you have group coverage through that large employer. Then Medicare is optional. You can sign up for Medicare Part A and or Part B at 65, or you can delay Medicare, which means you do nothing and you sign up for Medicare at a later date and you continue staying on that large group health plan through active employment, either your employer or spouse's employer. So some reasons why an individual would stay on their group health plan, their large employer's benefit, as opposed to moving into Medicare, is it's competitive. The group plan may be more competitive to Medicare, especially if you're a high earning individual and you may see IRMA if you do enroll in Medicare. So I would say the competitiveness of that large employer group health plan is a determining factor of delaying Medicare or not. Are you contributing into an HSA, health savings account? If you want to continue contributing into the HSA, then delaying Medicare A and B is advantageous. Do you have younger children on that group health plan or a spouse on that group health plan? And you want to continue covering the family, then that would be a great reason as to why you would want to delay Medicare at 65 and stay on that large employer's group health plan. Okay, those are just a few examples. There's other reasons as well. Perhaps your medications are covered at a better rate. You have a specific doctor. Again, that's something our team will take a deep dive and assess once we get more information around your unique circumstances. So if it's a large employer and you're working past 65, then Medicare is optional. We'll help you decide if you want to move into Medicare or not. Sometimes we tell clients, do nothing, stay on the group health plan. That's easy advice for us to give. If you or your spouse are working with a small employer with fewer than 20 employees, then Medicare A and B is required. Medicare must be the primary payer, which means you have to sign up for Medicare at age 65 in that initial 3-month window or shortly thereafter. to avoid lifelong penalties. So again, here, the size of that employer determines whether or not Medicare is required or if it's optional. If it's optional, then you can delay Medicare and avoid any penalties. If it's required because you or your spouse are with a small employer, fewer than 20 employees, then Medicare is required to avoid lifelong penalties. A little bit more on the HSA component. If you are on a large employer group health plan and you are maxing out your HSA, then we typically avoid signing up for any part of Medicare, even the free Part A benefit, because Medicare and IRS do not allow you to kind of double dip the system. You cannot have your HSA group health plan and max out the HSA and have the free Part A hospital benefit in the background. Medicare looks at that as a double dip. You're getting the tax benefits of being able to contribute into your HSA and the Medicare Part A free benefit, which becomes the secondary payer, is containing your hospital exposure in some way. So you're getting tax benefits and you're lessening your financial responsibility, your burden if you do fall into the hospital and land in the hospital. So it's no longer a high deductible group health plan because you have a low deductible with your Medicare Part A hospital benefit. I know that can get a little choppy and confusing, but just know if you have an HSA, speak with one of our teammates to make sure we're not running afoul of any IRS regulations and fumbling through this process. Okay. All right. So what is Medicare? Once we consult with you and the decision is to move into Medicare, whether that's at age 65 because you're on an ACA plan or COBRA or a small group employer plan and you have to move into Medicare at 65, or if it's at a later date, age 70, you're coming off your large employer group health plan, you're retiring and creating this special enrollment window to move into Medicare. What is Medicare? When the decision to move into Medicare is made, what do we need to do? Well, we need to sign up for Part A and Part B. Everybody will pay a premium for the Part B, and what you pay is determined by your income. So again, two moving parts of original Medicare. You have your Part A hospital benefit and your Part B medical benefit. So when you get your red, white, and blue card, you're going to have Part A and Part B. If you or your spouse worked 40 quarters or more throughout your lifetime and you paid into the system, then you will reap the Part A hospital benefit for free. You and your spouse can piggyback off of that 40-hour work history to get to the 40-hour requirement. So most of us will pay zero for the Part A hospital benefit. The Part B medical component is $185 per month. And this is set each year by Medicare. So last year it was about $10 cheaper. Next year in 2026, it may be adjusted based on Medicare and what they release. But for the most part, this is the standard Part B premium that the majority of us will pay, the $185 per month per person. If you're collecting Social Security, that $185 per month will draft automatically out of your Social Security benefit. If you're not collecting Social Security, then you'll get billed quarterly, or you can set up an easy auto pay out of a checking account. Now, if you are high income, making above $212,000 as a joint filing couple and modified AGI, or 106,000 as a single tax filer, then Medicare will be more expensive. Instead of paying that $185 per month premium, the standard rate, Medicare will get adjusted. You'll see a surcharge or an income surcharge tacked onto that Medicare premium. Excuse me. Sorry, guys. Let me share this again. Share. Okay. Um, where were we? Sorry. Love technology until it's not your friend. Okay, back at it. So everybody pays the 185. If you are in that higher earning bracket, then you'll see an IRMA surcharge tacked on there. This could range anywhere from $50 a month all the way up to about $600 a month. I'll jump into the IRMA discussion here shortly in the third segment of this presentation. So hold that thought. Just know that Medicare is income-based. And this is exactly where that income surcharge will come into play, is what do you pay for the Part B Medicare component, okay? So when you sign up for Part A and Part B, you will have a designated red, white, and blue Medicare card. If you don't set up any other ancillary coverage, you have no Medicare supplement, you have no Part D drug plan, you have no Medicare Advantage plan, Part C, what do you actually get with just original Medicare, your red, white, and blue card? So again, you're paying that monthly premium, the 185 plus any Medicare surcharge. And let's say you go into the hospital. Medicare Part A hospital benefit has a roughly $1,600 per 60-day occurrence deductible. So if you go in the hospital in January and then you go in the hospital again in June, essentially you have two $1,600 deductibles that you're responsible for. If you go and you start seeing doctors, you get an MRI, you're in for an outpatient procedure, maybe a surgery, some physical therapy, all of those surcharges and service charges will go towards the Part B medical billing, okay? With Medicare Part B, boy, you have a $257 per year deductible, so much smaller, and it's an annual deductible exposure. So if you're getting the MRI with 3 months of physical therapy and a few doctor office visits, you pay the $257 deductible for the year, and then Medicare is covering 80% of the residual claim. You are responsible for the 20% coinsurance or 20% leftover cost. So again, here, there's no cap on your 20% exposure with just original Medicare. So your deductible for Part A, each 60-day occurrence, your smaller annual medical deductible, and the 20% coinsurance with no cap or ceiling is where all of these ancillary products come into play and they come in to fill those gaps of original Medicare. Also, you'll see here that original Medicare, the red, white, and blue card, does not include drug coverage. It does not include dental or hearing or vision. All of those ancillary products come in to fill those gaps that original Medicare is lacking coverage on. Okay? All right, so how do we fill the gaps? I keep throwing out ancillary coverage. So here, essentially, there's two pathways to obtain coverage and get a comprehensive package once you do decide to move into Medicare. So here, your first pathway is on the left side of the screen. If you are somebody who tells me, hey, Margo, hey, Team Steinlage, I really want Cadillac coverage. I want to go to any doctor nationwide that takes Medicare. I don't want any strings attached, pre-authorizations, any headaches. Then this left side of the screen where you have original Medicare with your Medicare supplement and a standalone drug plan, that's the pathway that will give you as the policyholder the most flexibility and freedom. If you are a client who says, hey, Margo, hey, Team Steinlage, I like risk. I'm going to take on a little bit more risk to keep my monthly cost as low as possible and really get all of the bang for my buck that I can get at a zero premium, then that Medicare Advantage pathway, also known as Part C, is going to be a great option for you. My goal with the next 2 or 3 slides is to really fine-tune your plan selections and go over the pros and cons to each pathway of coverage. Okay? It's important to note here that no matter which direction you ultimately choose, we could care less. Our goal is to educate you so you are making the right decision from day one, and you know what those long-term consequences of that initial decision are so that you are fully aware and you're an educated consumer. That's my goal and my team's goal. We don't care which route you go. We just want you to be educated and happy. But know that no matter which route you choose, you are still paying Medicare either through that Social Security charge, or you're set up for Easy Pay, or you're writing a check every quarter. You are still responsible for that standard $185 per month charge, plus any IRMA, income surcharge, okay? So that's standard no matter which route you choose. And it will fluctuate each year as Medicare sets the standard premium amount that all of you will owe. Okay, so option one, this is the Cadillac pathway. You want total flexibility. You want Medicare as your primary payer. You don't want any network, okay? Original Medicare, your red, white, and blue card will be your primary payer. This is your gatekeeper. You can go to any doctor nationwide that takes Medicare. The question you will always ask the provider is, do you take Medicare? Then you'll set up a Medicare supplement, also known as Medigap, ancillary plan. This is going to be your secondary payer. So if you go to any doctor nationwide that accepts Medicare, you go to Mayo Clinic, you're down in Florida, you're down in North Carolina, wherever you are, do you take Medicare? The provider will bill Medicare. Medicare will turn around and submit the claim to whoever you have on file with your supplement or Medigap policy, okay? There is no question around, do you take my United Healthcare or my Blue Cross or my Aetna? That's off the table. Do you take Medicare is the primary question. Okay, so with this level of coverage, with a Medicare supplement plan, you need to make a decision. Do I want a Medicare supplement plan G or plan N? What level of Medicare supplement coverage do I want? If you are somebody who says, I don't want any bills coming into me, I want the best coverage I can get, then that Medicare supplement plan G policy is going to be the best bang for your buck here. You're going to show your Medicare card, you're going to show your supplement G girl card, regardless of who that supplement carrier is with. And your only out-of-pocket exposure from a medical and hospital standpoint is that $257 Part B annual deductible. Once you satisfy that, which typically comes with one or two services, then 100% of the services rendered for the rest of the year are covered at 100%. So if you're in and out of the hospital, you have 3 MRIs, you have months of PT, a couple of surgeries, doctor visits, your only out-of-pocket exposure with this level of coverage is $257 for the year. One step down in benefit from a Plan G supplement is a Plan N supplement. With a Plan N, your only out-of-pocket exposure with Medicare plus Supplement N is a $20 copay to providers, a $50 ER copay, and that $257 deductible. If you go to a non-assigned Medicare provider, Plan N also has a Part B excess exposure that you need to be aware of. Okay, so somebody who just wants the ultimate coverage, Plan G is going to be the safe bet. Plan N, depending on your state, may be a little bit more risky if you can't move N to G without underwriting. I'm going to plant that seed now. You can ask me and my team about that at a later date. Okay? So with Medicare and a supplement, you'll also need to get a third policy. You have a Medicare card, a supplement card, and a drug card, a standalone prescription Part D, PDP drug card. Okay? This will vary and change each year as we assess your most up-to-date drug list with the most up-to-date drug market. Which drug plan we recommend is purely based on your preferred pharmacy, your specific itemized drug list. Do you like mail order or retail pharmacy? And those negotiated prices with the 20 different drug plans. And we will help you make a decision each and every year on the most appropriate drug plan as your drugs change and the market for the drug market changes. So this is something we will reach out every fall and we'll say, hey, buddy, hey, John, we need to shop your drug coverage for 2026 because of X, Y, and G changes. We recommend a new plan, or we're recommending that you stay put. I would say 10, maybe 15%, but mostly 10% of the population will make a change on their drug coverage each year. The drug plans are used to be pretty volatile, but now with this Inflation Reduction Act coming into play, we're seeing a more even-keeled playing field on the drug product. If you're somebody who wants dental and vision as well, this would be an ancillary product that we would stack on and we would add to your Medicare supplement and drug plan combination. So we're kind of cherry picking the most appropriate plans based on your zip code, your age, your smoker status, your drug list, your preferred dentist. And we're really getting you a portfolio of product that's unique to you and you only. Okay. If you go this route, Medicare with a supplement plan, you do have some foreign care coverage. Remember, Medicare is only covering you in the US. Your Medicare supplement product will cover you at 80% up to a $50,000 lifetime amount for foreign care emergency coverage. So Medicare won't cover you, but your supplement will indemnify you up to 50 grand essentially in a lifetime. If you want some additional travel health insurance coverage, we have products that we can recommend as well. So here, flexibility is key. The negative is that, hey, I don't just have one card that I'm showing for all of my medical, dental, drug services rendered throughout the year. I have a combination package. Also, you're paying for this. The Medicare supplement premiums will adjust by about 5 to 10% per year. That's the new average post-COVID. And then the drug plans will manipulate their products. So we need to adjust your coverage. And we also need to shop and be conscious of the pricing and the increases each year that you'll be responsible for. So you're paying upfront in premium, knowing that on the back end, you are pretty much covered at 100% from a hospital and medical standpoint. Okay. The alternative pathway, if you're the client that says, hey, I want to bundle everything in one nice, convenient card, and I don't want to pay much for my health insurance, I'm healthy, then this Medicare Advantage product is very popular. 50% of the market will go Advantage. 50% of you will go Medicare with a supplement and drug plan. Your neighbor goes Advantage. You and your family go supplemental. So there's no right answer here. Our goal is to kind of poke questions and show you the negatives and the positives to both pathways so that you are making the wisest decision based on your unique circumstances. So here, if you opt for a Medicare Advantage Part C HMO or PPO plan, most Advantage plans, Part C plans, have a 0 premium. So you are still paying that Part B premium, the $185 per month. And as soon as you enroll in your 0 premium HMO or PPO plan, that HMO or PPO that Advantage plan becomes your primary payer. So you're going to put that red, white, and blue card in a very safe space, and you're never going to use it until you opt out of an Advantage plan. So your Advantage plan becomes the primary payer. You show your HMO or PPO Advantage card for medical, hospitalization, skilled care, dental, vision, drug coverage, gym membership. You show it for everything, and you pay zero for that coverage. On the flip side, if and when you start using care, you are paying copays and services for all in-network providers. You're going to get the most bang for your buck when you use the network providers and you follow the rules of your Advantage plan. So that can be convenient for some of you. Hey, they're my gatekeeper. They're setting my restrictions. Others will say, I don't want pre-authorization. I don't want any network restrictions. A PPO versus an HMO can eliminate some of that frustration with the networks. An HMO will require in-network use only. You can't go out of network unless it's an emergency. A PPO is kind of a balancing act. You can use in-network doctors for the best cost savings, but if you need to go out of network, you can go to most doctors that take Medicare, and you'll pay a higher co-insurance or service charge if and when you do go out of network. But it does allow some flexibility if and when you need that coverage out of network. So here you pay nothing in premium, little to nothing. And if and when you use care, whether it's an HMO or a PPO, you are paying for each service rendered a copay or a negotiated coinsurance with your insurance carrier, your HMO or your PPO. Once you hit the plan's maximum medical benefit, whether it's $2,000 or $8,000, this varies drastically based on your zip code. Once you hit the plan's maximum, then the HMO or PPO will pay 100% of your medical or hospital coverage for the remainder of the year. Okay, so this keeps your costs low each month with a low monthly premium or no monthly premium, and caps your exposure if you do have something catastrophic. Where these plans can get frustrating is if you are a high user of medical services and you are needing pre-authorization, you're in and out of skilled care. Sometimes that can get frustrating from a user's perspective and makes this alternative Medicare plus supplement and drug plan pathway much more flexible and headache-free. So I would say here are the positives. You're containing your costs. You're bundling a lot of different premium products, dental, vision, drug, into one zero premium HMO card. That's the positive. The negative is that you do have a network, you do have pre-authorization, and you have to play by the rules and red tape of these insurance carriers. Again, this includes drug coverage, dental, vision, all built into that HMO PPO Part C Advantage product. And that is your primary payer. Another kind of buyer beware notice here is that if you make a decision, your decision will have long-term consequences. In most states, if you move to a Medicare Advantage plan, you tell me, hey, Margo, I want a zero premium plan. It's going to give me the most bang for my buck. I want the free dental. I want the vision and the drug coverage all built in. I'm going to say that's great. But just be aware that if at a later date you want to drop that zero premium Medicare Advantage plan and move to that Cadillac Medicare plus supplement and drug plan kind of prepay model, you have to go through medical underwriting. So as you're in this, I'm new to Medicare window, I'm turning 65 or I'm coming off my large employer plan, I'm picking up Medicare for the first time, you can move into a supplement or an Advantage plan without any health questions. But at a later date, 2-3 years down the road, you say, hey, Margo, I want to drop my zero premium Advantage plan and move to a Medicare supplement. In most states, you will be required to answer health questions, and the supplement will either accept you or deny you based on your health risk. If you're denied, then you're kind of funneled into this Medicare Advantage product, and we can shop HMO to PPO, PPO to HMO, carrier to carrier within that Advantage plan product, but you're locked out of getting that supplemental pathway of coverage, the left side of the screen, because you're too high health risk. All right, so you're healthy now. What does the future hold? Is kind of my goal with creating this education is, hey, you can get locked into the Advantage plan. Is that the wisest decision from day one? If it is, great. We've educated, you know the consequences to this decision. Now we can move on and find the right product based on your specific doctors, your drugs, your dentist, etc. If you're somebody who says, I don't want to risk that chance, I may become unhealthy at age 80, I'm willing to pay into the supplement and drug plan to guarantee my access to any doctor nationwide with providers who accept Medicare at a later date with no pre-authorization requirements. Okay, so here, if you do choose the more expensive pathway, the Medicare plus the supplement and drug plan, and later you say, hey, I'm not seeing value in it, or I want to drop that supplement and move to the Advantage plan, it's more attractive for me at this point, we can do that very easily during the Medicare annual enrollment period, which is in the fall. No health questions or restrictions of movement if you're dropping a supplement and moving to that zero premium HMO or PPO Advantage product. All right. Also, with the Inflation Reduction Act that was passed recently, everybody has a $2,000 cap as of this year, 2025, and moving forward. Moving forward, that may adjust, that may increase slightly. But right now, for 2025, everybody has a $2,000 cap on their drug out-of-pocket exposure for covered medications. So if you're somebody that says, hey, I get Synthroid cheaper through X, Y, and Z Canadian pharmacy, Synthroid will not contribute to the $2,000 max. You have to use your drug plan, and the drug plan has to have the medication on its formulary for it to whittle down that $2,000 maximum. Once you come out of pocket $2,000, essentially, now the drug plan pays 100% for your covered medications. So here, most drug plans in 2025 have some deductible where you have to pay upfront for your medications. Once you satisfy and come out of pocket $590, then you're responsible for the remaining, $1,400 essentially to get to $2,000. So here we look at your drug list. If it's a husband and wife, you guys may have different drug plans based on your unique drug list. So we're isolating you specifically, and we're setting you up with the right plan each and every year here. All right, IRMA. So anyone who is a high earning individual, this needs to be on your radar. So here, if you are a single tax filer, your household size matters. If you're a single tax, not household size, how you file, excuse me. If you're a single filer, any modified AGI above 106,000 will expose you to an income surcharge. If you are filing jointly and your income is above 212,000 in modified AGI, then you'll see an income surcharge. And what Medicare is doing is they are using your prior 2-year tax return. So if you turn 65 in 2025, Medicare is coordinating and communicating with IRS and grabbing your 2023 tax return information and using that modified AGI status for 2023 to set your 2025 IRMA surcharge. So again, you're going to pay the $185, that's the standard rate, And if your 2023 income modified AGI was higher than 106 and 212 as a single and joint filer, then 185 will increase based on your 2023 modified AGI figure. Then next year in 2026, you're still on Medicare. You're saying, Margo, this is great coverage. Thanks for hooking me up. In 2026, you're going to get a notification from Medicare, and they're going to say, hey, we're redetermining your IRMA, your income surcharge for next year, 2026, based on your 2024, your prior to your tax return. So this IRMA, income-related monthly adjusted amount, it's not your Aunt Irma. This IRMA will adjust each year based on your filing status and your prior 2-year look back. Okay, you're never stuck with that high earning year that was on file when you initially enrolled in Medicare. We can also, before I show you the chart again, we can also appeal this IRMA and ask Medicare to reconsider if you've had a life event. So if in 2025 you are retiring and you were making 400 grand in 2023, but now in 2025, January 1st, you retired and your income went from 400K to, 160,000 with passive investment, we can tell Medicare, hey, don't use my prior 2-year tax return. Use my anticipated retirement modified AGI in 2025 because I've had a life event. I've retired. I reduced work hours. I got a divorce. My spouse, my high earning spouse passed away. So you're never stuck with the IRMA that is attached the first time you enroll in Medicare. And we can ask Medicare to reconsider or appeal your IRMA if you've had one of these life events in the past, year or two. Okay, so this is something we hold your hand through. The appeals typically take anywhere from 2 months to 3 months, sometimes longer. So we want to assess and see if there is an available appeal based on your needs and your situation. And if so, we'll assist with getting the paperwork filled out. So here you can see if you're turning 65 with plans to work with a large employer, Medicare may not make sense for you because you're still working, you have a high income, and the IRMA on some of these are quite high. If you're making, as a single filer, anywhere between 200 and 500,000, Medicare, instead of being $185 per month, your standard rate, Medicare is going to be upwards of $670. So again, Medicare may not be the wisest decision if you're working with a large employer. Also, let me take one step back. Medicare will add IRMA to both your Part B premium, the $185, and they'll stick a small IRMA surcharge on any drug plan you choose, whether it's that zero premium Medicare Advantage pathway that has Part D built in. You'll see a few extra dollars attached to your Advantage plan if you have IRMA because you're a high earner. Or if you choose, a $0 or $20 drug plan or $100 drug plan, you're going to see an extra IRMA income surcharge tacked onto that drug plan, in addition to the IRMA surcharge on top of the Part B. Medicare is not free, people. You'd be shocked by how many times I get that question, but Medicare is not free. And if you're a high earner, you're paying more because of that high earner status. So here you can see if you are in that IRMA bracket, you're paying anywhere from an extra $75 roughly to $440 just for your IRMA Part B, plus your IRMA Part D. So again, you're ranging between $185, no IRMA, all the way up to $715 with the highest IRMA bracket being triggered. So again, our goal is to help you put all of these moving pieces into play and make the wisest decision based on your needs and your unique circumstances. There is no one-size-fits-all approach here, which gives me and my team job security, but also makes this a really frustrating experience if you're trying to do it on your own. Again, no charges for our service. Our goal is to provide you with clear, concise information and be a resource through this entire process and transition. Once we've assisted with your initial onboarding, we've assisted with getting Medicare paperwork completed, you have Medicare in force, we've assisted with kind of fine-tuning a plan strategy and helping you enroll in those desired plans. And now you're a few months into using your Medicare coverage. What happens with our relationship? Well, we will reach out in usually about August. We send all of our clients a email campaign. You'll get 2 or 3 saying, hey, in October, it's the annual review period for Medicare. Our team needs more information from you. We need your up-to-date drug list. What changes have happened? Have you moved? Has anything changed on your end? We collect that information in August and September, and then in October through December, our team is working like gangbusters to shop the most appropriate coverage for the upcoming year, okay? So in 2026, we may or may not manipulate your drug or advantage plan based on the market changes, and we will reset or auto-renew your policy for January 1st each year. So our relationship with our team is ongoing. We provide back-end support in addition to proactive reviews. Medicare is never a set it and forget it agenda. If you do, you will lose out. You'll overpay. You'll miss opportunity to get better coverage on medications. You're at the whim of the plan designs, which are constantly changing. Okay. Some miscellaneous items before I wrap up. We advise clients to use their drug Medicare Part D component, whether it's a standalone drug plan or an Advantage plan with built-in drug coverage. We recommend you use that Medicare product in addition to cost shopping through GoodRx or Mark Cuban or Canadian pharmacies. Medicare, shocker, does not always give you as the consumer the best access to medications and or pricing with medications. So I highly recommend if you're on group coverage right now or ACA right now and you're moving into Medicare, or you're watching this as just a recap or you wanted to see me again, use GoodRx. Go plug in your medications on GoodRx and see if there's some wiggle room for savings. Same with the Mark Cuban Cost Plus Drugs. He's the Shark Tank guy. Great opportunities to save, $10, $20, $30 a month in copays on medications that are cheaper through these platforms as opposed to using your insurance, whether it's Medicare or ACA or a group plan. Also, in the past, our team has always kind of poo-pooed dental. Dental has taken a radical shift. There are new dental plans that are still low in premium, but open up their access to $3,000, $4,000, $5,000 worth of dental benefits per year, which is new. In the last decade, most dental plans capped your benefit at about $1,500 a year. Now we're seeing that benefit double, which makes dental more competitive and more appropriate as you move off your group or ACA plan and into Medicare. Okay. Also, we're in this unique market with the Trump administration and radical changes happening weekly. We're in this unique scenario where it's prudent to stay on top of Medicare and the ever-changing regulations. So our goal with our current clients, not only do we pump out content that's super informative to you as a Medicare consumer, but also each year before the October annual enrollment kicks off, we invite you to an annual enrollment period where we will go over the upcoming changes in clear, concise terms so that you are aware of how that will impact you as a Medicare consumer later as you start utilizing your insurance. My recommendation and my team's recommendation is don't do this alone. Utilize our free service and start your Medicare process early. We usually have consultations 6 to 12 months out from your Medicare 65 window, and then really start kickstarting the process and creating your timeline 3 months out from your 65th birth month if moving into Medicare at 65 is the right pathway for you. So again, a lot of changes, a lot of information. I could talk about this all day. I tried to keep this pretty high level to not overwhelm you, but we can go into further detail based on your unique circumstances. Just call us, set up a phone call with myself, our team, and let us dissect your circumstance and help make a game plan decision as you approach your 65th birthday. So thank you again for watching. Please feel free to share this video with any of your friends or family. We are always here to answer questions. You guys have a good one.